Hi. All right. So my name is Selena Allen, and for my oral presentation, I decided to research walking pneumonia. Okay, so first off, what is walking pneumonia? Walking pneumonia is clinically known as atypical pneumonia, and atypical pneumonia um, presents much milder symptoms than what is usually contracted, which is typical pneumonia. Atypical pneumonia got the nickname walking pneumonia because it is very common for people who have contracted this illness to just go about their daily activities without experiencing any symptoms at all. Okay, so here are some of the characteristics of walking pneumonia. So walking pneumonia symptoms can be developed over a longer period of time, over the course of 1 to 3 weeks. This illness is most commonly mistaken for the cold or flu just because they do have very similar symptoms. This illness is contagious and can be contracted through airborne droplets, usually through coughing, sneezing. It is very easily spread, most often in very crowded places such as schools, workplaces, areas like that. Okay, so what causes walking pneumonia? The causative agent of walking pneumonia is Mycoplasma pneumoniae, and this organism is a bacteria. And this bacteria is different than most other bacterias in that it does lack a cell wall. And because this organism does lack a cell wall, it makes it much harder to treat with standard antibiotics because these antibiotics, such as penicillin, work by attacking and breaking down the cell wall of most bacteria. This organism works by, once inhaled, it will attach to the respiratory lining, and once it has bonded there, it will cause inflammation within the lungs respiratory tract. Okay, so here are some of the most common symptoms of walking pneumonia, which are also very similar to cold and flu symptoms. So we have headache, fatigue, mild fever, chest discomfort, also sore throat, a dry cough. And some of the other symptoms include things like vomiting, diarrhea, wheezing, which are more common in children. And I do want to note that wheezing is one of those symptoms that over an extended period of time, or if it happens to worsen, it would be important to seek medical treatment at that time. So, some of the risk factors of walking pneumonia, or individuals who are more likely to become infected or experience more severe symptoms of this illness, would be people who have a weakened immune system or who are taking immunosuppressants. Also, people who have a history of tobacco use or who may smoke other things, chronic lung conditions such as COPD or asthma. Also, this illness is much more common in young adults and children than it is in older adults. As far as treatment, because walking pneumonia is much harder to kill with antibiotics such as penicillins, um, usually antibiotics that are meant to target protein synthesis are the first choice for treatment. So macrolides are usually the number one choice, such as azithromycin. And these work by attaching to ribosomes. They bind to ribosomes, and by doing this, they help to interfere with protein synthesis of that organism. And by interfering with protein synthesis, they help to prevent replication, which in turn helps the spread of the disease. And macrolides are usually the number one choice just because they are very effective, they are much less toxic, and they are a lot safer for young children. So these antibiotics are usually taken over the course of 5 to 10 days, and usually when following the antibiotic treatment properly, recovery can happen within a few weeks. Some other forms of treatment include pain and fever reducers, as well as cough suppressants, and just rest and staying hydrated. Okay, and finally, on to prevention of walking pneumonia. So, probably the top preventative measure um, would be proper hand hygiene, as well as being sure to cover your mouth and nose whenever coughing or sneezing. And not just putting your hand over your mouth, making sure to cough into your elbow or cough into a tissue and making sure that you're properly disposing of that. Um, Also, avoiding close contact with anyone who may be infected, or just in general, maintaining a safe distance, especially in crowded areas. Also, just boosting your immune system through healthy habits such as a healthy diet or proper exercise, maybe taking daily multivitamins, things like that. But that is walking pneumonia. And here is my works cited.